Let me share my screen. Welcome to our webinar. Ale, can you tell me if the right screen is showing up?
Yes.
Thank you. I'm always afraid everybody's going to see my usually very embarrassing wallpaper pictures. Welcome, everyone. Happy June. Happy Pride Month. Happy start of summer, though for those of you in the Midwest and the South, you're feeling it like, start? What do you mean? We're in Hades right now. Thank you so much for joining our very exciting webinar. And I don't want to spend too much time in introductions, so I'm just going to get us started. My name is Becca Wright. I'm your very loose co-host or host for today because we have an exciting panel of presenters. And I'm so excited that our lead digital navigators will be co-hosting today. So welcome to LGBTQIA plus tech advocacy to celebrate in Pride Month. As you know, we will be giving away a very exciting course, must be present to win at the end of this. The online course that we're giving away is specifically for program managers or for decision makers, leaders, supervisors, managers. It's all about assessing community needs. It provides a lot of practical resources, a lot of templates and guides and strategic material. But if you're interested in any of our online courses, as you know, they run the gamut. And if you just want to click on this QR code really quickly just to take a look at what we have available, please go for it. Today's panelists, we have Bailey Alman from IBM, who will be joining us here in just a couple of minutes.
I'm on.
Yes.
Hi, all.
Bailey, yay, okay, great. We have Marcos Suarez from the San Antonio AIDS Foundation.
Hello, everyone.
With his interesting background. We have Roman Narvaez from Alamo Area Resource Center.
Hello.
And last but certainly not least, we have Wayne Winches from Living Positive San Antonio. He might be distracted by what he calls his army of dachshunds, which I personally wanted to have their own slide, but I'm trying to be presentable. You know, here's professional Becca at work on behalf of Digital Lift. You're welcome. I also want to highlight our moderators for today, who all credit for this webinar goes to. My co-host in all of these webinars is Alejandra Alcaraz. She's our lead digital navigator and works very closely in our partnership with Methodist Healthcare Ministries. She's located in Austin. I'm also super happy and thankful and proud of Ethan Baca, who is our lead digital navigator and also works quite closely with Methodist Healthcare Ministries in San Antonio. With that, I will be stopping my share and I will be leading us right into our presentation today. One last comment. I'm going to go away and I'm going to monitor the chat. Please, everyone, make comments along the way in the chat. Put your questions in there, put comments in there, because what we would love to do is spend several moments of Q&A at the end before we do our special raffle giveaway. So please take advantage of that. And with that, I'll turn it over to Ethan and Ale.
Hi, everyone, and welcome to the LGBTQIA plus tech advocacy and plus motion. Thank you for joining us. My name is Alejandra Alcaraz, and I'm really excited to co-host today with Ethan. Ethan and I work together as lead digital navigators, and this webinar today will focus on the digital barriers that the LGBTQIA individuals face, whether it's accessing healthcare, housing, or navigating media and misinformation. We'll explore the impact of these challenges and discuss practical solutions to promote digital inclusion, affirming care, and community advocacy. Much of this advocacy begins with our youth, who are often the first to speak out, innovate, and demand change in both the digital and physical spaces. So today, our panelists are going to come together from a range of advocacy, healthcare, and technology backgrounds, and they will share insights and strategies on what they do in their field. But before we get started, I just want to make very quick notes. Feel free to say hello in the chat and let us know where you're coming from. And please drop any questions at any time. And at the end, we'll have our Q&A. And with that, I'll let Ethan kick it off.
Awesome. Thanks, Henry. So the first thing that we want to talk about, and this is very big, especially given what happened earlier this month with the testing funds, is LGBTQIA plus individuals, such as myself, often face discrimination and privacy concerns when accessing digital healthcare systems. So I would like to ask my friends and colleagues on the panel, what digital challenges does our community face when accessing telehealth and scheduling medical appointments? How can improving digital literacy, especially with youth, ensure affirming, timely, and independent access to healthcare throughout their lives and our lives?
Ethan, can you repeat that? I want to share, but I didn't really catch the question.
It's all right. So it's what digital challenges do queer individuals such as myself and my colleagues on the panel face when accessing telehealth and scheduling medical appointments? And how can improving digital literacy, especially among youth, ensure affirming, timely, and independent access to healthcare throughout their lives and our lives?
Wow, that's a hard question.
It is a very hard question. And our panelists here today, they have the insight to give us kind of what they see with their clients. And so, Marco, like, what is something that you've seen?
So we have to start by talking about the different spaces that our patients work with. One is going to be the first thing, that is digital equity, something that I really want to bring up you as our coworkers and our partners in crime, because I didn't know what equitable equity up for a couple of months till I met Ethan, and that made a lot of sense. That I didn't know that, for example, all these barriers that a lot of our clients have, like having access to mobile devices or to email addresses, they're things that they're challenged for their day to day. And us to know about these opportunities, it gives us a big opportunity for them. Because us as the middle ground between the digital equity and the clients, we can start promote the services, because clients will have a lot of barriers in different in all their lives. Will be financial barriers, will be technology or updating. When we're talking about a person that just got into technology or that is getting is not getting updated itself on technology. I think that these are the biggest barriers that we see, mainly in the San Antonio AIDS Foundation. Something else like, okay, could I contact you? No, sorry, I don't have a phone because I'm experiencing homelessness. Um, I I don't have mobile data for my phone, so you cannot call me. So we have to be there on that day-to-day basis, to offer these opportunities for them, or to actually be resourceful on what we could do with it.
I'm going to piggyback on what Marco had to say, especially people that are experience homelessness, displacement, or what we also say is surfing. Many of my consumers are in that position, and again, the barriers that I see is, so they might have a mobile device, they don't have a service to the mobile device. What do you do then? You're so limited. I mean, I really wish there was some way we could get the city of San Antonio on board on this, where we would have more charging stations that would be able to supply, a internet connection at that time. And that's where I'm thinking on this.
Yeah, and I'll just say, like, from a large corporation perspective, which is interesting because I'm very, as most people know me in my personal life, I'm very anarchist. So it's funny that I work for a big corporation job. But I will say that what IBM strives to do is also close the digital divide a lot. So we do offer, it's through Skills Build, but we do offer like free learnings for generative AI for underrepresented communities. So it's all about, to me, accessibility, honestly. Like when it comes down to it, it's like really meeting your users where they're at. So I know that a lot of like underrepresented communities, like a lot of their access comes at public libraries. So obviously putting more information in front of them at the library where they're going. However, a lot of people don't also have access to the library, so it's a challenge, right? Like there are going to always be barriers because of the economic and socioeconomic struggles that we face as LGBTQIA individuals, but it's also then, I would say, what our resiliency, our power is our community and the way that we show up for each other. And so being able to bring resources to those who need them or bring people to the resources is definitely something that we can focus on.
I guess a quick follow-up to that, because we still have a couple of minutes left, is how can bridging that gap help ensure that we have equitable access to healthcare, especially given that, for example, I have a doctor's appointment this afternoon and I have to register on my phone before I even go. I'm going to give this one to Roman because I'm also a patient of the Alamo Area Resource Center, or ARC. And it's the same thing. Most everything is done through their app. So Roman, how can we ensure equitable access to that and the skills?
Yeah, so one thing we definitely and I have a lot of clients who I work in early intervention services. So specifically, my clients are people who are either newly diagnosed with HIV or people who are return to care. And the return to care clients, especially, can be experiencing varying levels of housing stability as well as access to technology. And one thing that our clinic does do is a lot of our interactions with the clients or with the patients is done through our through the Helo app. You know, they can check, reschedule appointments there, communicate directly with their physicians there, as well as monitor the status of any referrals or prescriptions. But unfortunately, like Ethan said, a lot of the clients that come through ARC, they may not necessarily have access to something as simple as a cell phone, you know, something we take for granted. That we assume everybody kind of has. And even the people who do have access to that technology may not know or understand how the app itself works. So part of what I do in early intervention services is we specifically have set aside time to train our clients, the clients who do have access to technologies, how to utilize the app, what services they can use through the app, as well as, you know, how best to communicate with their doctors about important medical situations as they arise. And then for our clients who don't have access to those technologies, you know, we have to go the extra mile to make sure that their healthcare isn't suffering as a result of their inability to access technology. A lot of times, you know, this can present some pretty unique barriers, especially when it comes to communicating with clients. A lot of my clients right now, they are experiencing homelessness or unstable living conditions. So the last thing they're thinking about right now is having a phone on them.
Yeah.
So that's where we kind of go the extra mile. We usually utilize other interventions like house visits or visiting local homeless encampments, as well as, you know, going to other like shelters and places where our clients may be, try to set up specific times for meeting in these places so that way we know where they're going to be and they know where they can find us in the events that they're not able to communicate with us.
It's
So it's
amazing.
really all about like going out there, meeting our clients where they already are at, and you know, finding those workarounds when it comes to not having access to these technologies.
Yeah, and on that same note, having access to technology and being able to do anything is basically in every realm of our lives at this point. Education, workforce, healthcare. Speaking of economic barriers and the workforce development, access to technology is critical in the economic mobility, but remains unequal for the LGBTQIA plus individuals, especially our youth. So knowing that, how does limited access to technology impact our individuals in our community, especially the youth, at different stages of securing housing, employment, and economic stability? And how can partnerships with companies like IBM support inclusive workforce development and digital training opportunities that reflect diverse communities? So we'll let Bailey start that one off, because the workforce space is, when people dream big in Austin, they're like, I want to join the tech space. Like, I want to be part of that tech world. And we want that to be accessible across the board.
Yeah, so I think like the first thing for me is just like, I mean, I will be honest. I was always very, I would say, some people would say cocky, I would say confident. I just was, I'm a first generation American. I'm from my mother, and then I'm also Black and Southern from my father's side. And so I think like having that first gen mentality was like very much like a primer for me to be ready to be like, I deserve this and I want this and I'm going to work my ass off to get this, and no table is too big for me to sit at. Like I will get a stepping stool, I will get the ladder, I will be sitting at the table like with the crown on. But that is also like how I took it, and I would give anyone the advice of like, if you want to be at that table, you should be at that table. That's like the biggest thing I could tell you. Even it doesn't matter if you're not, if you don't see yourself in that room, like you're going to become the representation in that room. And that was always something that I told myself. So I was never like, oh, I'm going to work in tech. I got a degree in marketing. Actually, I didn't even get a degree in marketing. That's a lie. I got a degree in public relations, and I work in marketing for a tech company. And I never thought that that would happen for me, but I just knew that like my work ethic was just going to speak for itself. And I think like I didn't give a shit about school. I was like a B plus student, maybe C plus student, if I'm being honest. And so I think really what it was is I was just like determined to make it work. And like I would just like really like I worked a lot. Like I just was an intern, and I think I was really good at like making interpersonal connections. So I would say it's not always about a skill build in like a hard skill, but sometimes your soft skills of like just like making connections, meeting people, and just kind of being yourself. And then I will say that like through obviously getting like I think like I got my job at IBM because my mom's a hairdresser and she like was doing someone's hair who was leaving IBM. So it just very happens chance, but I've been there for 7 years, and I think what's like distinguish me, even working with people that are older than me from different backgrounds, like maybe not as diverse backgrounds, has been that I've believed that I deserve a seat at the table. I'm a learner and I want to just continue to absorb things. And also like I'm not afraid to fail, because everyone's going to do that. So I would say as far as like also like being like queer and black and non-binary trans, like I again like believe that I believe at my core that I deserve those rights and I deserve those spaces. And like if I believe it, like I'd like to me, I'm like delusional as hell. And I'm like, no one else is gonna tell me otherwise. Even if they write all the legislation, like I believe it. So I'm gonna sit there. And it's hard. So having like the skill set to back it up is also great. So there's like a lot of free trainings, there's a lot of, different like courses. I would say like the city is really equipped with like free webinars like this and like a lot of access. But again, like you have to have access to those tools. So I will say in Austin, it's a little bit easier because there is a lot of public library space here, I would say, comparatively like to San Antonio or maybe some more rural parts of Texas. So we are very fortunate here. So I know that I'm speaking like from a position of privilege, but I would say that like, you can go to a friend's house and get on a computer if you can, and things like that, or even in-person workshops, they're still happening. So there are a good amount of free resources that are online, and because we are so digital, they are becoming more accessible and free. And so I would say that that's one thing. And then as far as like AI, like us as LGBTQ plus individuals, AI is interesting because you'll be able to like, a lot of it is language models, and the more that we use it, the better it's going to get to understand our community and also service up our needs. So I know that like it's very controversial right now, like whether or not we should be using AI and how the impacts are on the environment, et cetera. But the thing is it's here. It's been here. It's been here actually for like the last like 20 years. It's been taking in all your information. So now it's like, do you want to make it work for you, or do you want it to have it work against you? And I think if we use it more, it will learn to be more intelligent for us. So that's just one school of thought. I'm not totally bought in either all the time. So, and it can change.
Yeah, thank you for that. And anyone else that want to share a little bit on the workforce development part of what you've seen in your clients and how digital access is addressing that gap and where we're seeing it in every part of their lives? We have a couple more minutes. We have about 3 more minutes.
I would like to add something like coming from a nonprofit that it's like out of the corporate scene. It's a really different background, but basically I really agree with what Bailey said. They are different tools that they are out there, but sadly people don't have access to them because of the information that is accessible through them. Um, if anyone here has close by youth, I really, really, really push you to get them access to those information. With that information, I mean first addressing that they understand what they're doing, that they need to really have some skills, that they are critic thinking to know what they're doing, that they need to understand the responsibility that these tools may have to being worked with. Um, but they're really good tools. I really agree with what Bailey said about using the tools that you have, or you will have them against you. In any work environment that you are gonna be working, it's gonna be that. It's gonna be if you know more tools, um, it's gonna start being a competitive environment, but also let's talk about a collaborative environment. Like if you already have a coworker that is struggling because of age, language, um, and different access to the information that you have, always remember that there's tools available for you to have that critical thinking, to have that math skills that if, just like Bailey said, if you were, if in school math was not your best assignment, now the internet is full of opportunities. But to first have access to internet, there's places like Digital Lift that could get you access to the internet. So the thing that I really would like to highlight, that a lot of things are on the internet because the internet is huge. But the base of it, it will be like the responsibility that you understand the tools that you're working with.
Awesome. So one of the things that really stuck out about what you said, Bailey, is AI uses these language models and learns how we speak because we have our own lexicon, we have our own dialects, especially as queer individuals. So I wanted to go ahead and move into, media representation and diversity. And for the record, I'd also like to state that we are aware that while our panel is diverse, it is not the most diverse and does not represent every spectrum of the LGBTQIA plus community. Most of us are brown, most of us are gay, cisgender men. So I want to just make that, I want to acknowledge that before I ask this question. And this is something that's bothered me, being a heavier set individual for a very long time until I finally lost all the weight, is media misrepresentation and the lack of diversity of queer voices. How does, in y'all's experience, how has this impacted the community identity and our mental health, especially when growing up and when we are so vulnerable? And what roles does digital misinformation and online bullying play, and how can we build strategies to protect and empower our community, especially in these digital spaces?
I'm gonna go first because I'm very passionate about this, and I'm sorry, and because I'm not the cisgendered man on the panel. Um, but I think it's funny because I was typing in the chat, like I don't know if anyone's watching Love Island right now. I would like if you are, like, give me some love in the chat so I don't feel silly. I was, someone was like, why, how can you watch this? Like, it's just so nauseating. And I'm like, honestly, I think it's weird because it's like one of those shows that there's just no representation for myself in it. So I can disassociate to it. And I think a lot of people feel that way about like RuPaul's Drag Race, where in turn I feel like I associate so deeply with so many of those people on RDR. So I will say that like being I mean, I grew up like I'm 300 pounds right now. I grew up always big boned, big backed, black. You know, I was never allowed to wear things. I had facial hair always like kind of grown. Like, you know, I would say I identify very similarly to the struggles of those who identify as intersex. And it was never enough to be one thing or the other. And it just really was difficult to not have that representation. And like it did impact my mental health. But then I say like honestly, like what's so interesting is like seeing Cynthia Erivo as, it's so silly. I hated musicals, but seeing her as Elphaba and understanding the story of Wicked really in the context of like representation mattering. Like I came out of that movie at like 27 years old, like for the first time, like bawling, being like, if I had seen Cynthia Erivo in that moment grabbing for the broom for herself, like as a child, as a queer Black child, I feel like a lot of things would have been righted for me. So it's really just getting people, it's and we the ways that we can do it for ourselves and for our communities is like our own advertising. You know, if you're putting out HIV, you know, stats, etc., it does not need to be a cis man couple or like I've even, and you know, I've actually talked to like local clinics here where like if we're putting out resources for texting, it's not just cis male leather daddies. Like everybody needs to be tested. Everybody is getting some in some different way. Everybody needs those resources. So it's really just like making sure that we are also like putting the people in our community that are so different on the screen, on the, you know, getting their voices and recording their stories, because we do have an erasure of our history and we want to make sure that's preserved in addition to our longevity, because I think the more visibility that we have, the more of us there are. Like literally, like when you see, I feel like it's literally like science. Like if you see somebody that looks like that is living the life maybe that you want, you're going to try to attain that. And that is what influence is, and social influence. And if we're on all of these apps and mediums all the time, we can influence our own culture by being visible and like continuing to propel that forward and put forth more visibility.
I want to jump on and piggyback on what Bailey is saying. I think, especially for me in my area, my region, my city, I think we even build barriers sometimes when it comes to that. Like you say, Bailey, that you're not being seen. We're using stock photo, I notice, on our own media stuff that we're doing locally. I'm like, okay, I know there's plenty of people that do advocacy work in San Antonio. Why are not they not being represented? You know, I noticed this yesterday when I was at an appointment. I walked down a hallway. There were probably 50 to 75 pamphlets on this wall about different things, and they were all stock photo. They were the perfect cisgender men or the perfect size 8 woman with all the right curves and build and things like that. And straight couples, mainly heterosexual couples, you know? And I'm like, okay.
I'd like to ask Roman and Marco real quick because we have a few minutes left. One of the things that AARC has done, and I've noticed this because they have been great community partners for other organizations I've worked with, is they use actual clients and team members in their advertising. Whenever you're in their clinic, it's people that I know, my friends that have transitioned, and they're out there full pride saying, I get tested here every week. I am HIV positive and I'm doing this. I'm here for my gender affirming care. So, Roman, if you want to talk a little bit about representation in art, and then if Marco would like to piggyback off that.
Yeah, sorry, I was actually looking for the chance to kind of like throw my 2 cents in on this one. Two things. One, love Wicked. Two, totally agree with the way, specifically things like PrEP and HIV preventative care is kind of represented in the media. It's basically always seeing, cisgendered gay men in the advertising, and I've noticed that has a big impact on other communities, specifically, trans women, trans men, and even cisgendered women, bisexual women, pansexual women, a lot of them don't think that PrEP is an option for them or that it's even something that is for them, despite the fact that among those communities, we see higher rates of HIV transmission. But a lot of them don't think because of the way that it's marketed. And that's always something that's kind of bothered me. So I'm really glad, Bailey, that you brought that up. To your question, Ethan, yes, that's one of the things that I love about the place that I work. You do see that a lot of times where it's kind of just like generic stock photos of, attractive man, attractive woman. But none of it's really like representative of the community. And one of the things I love about here is you walk down the hallways on our resource center, you walk down the hallways of the clinic, and every single advertising you see for AARC or for the clinic, like those are all pictures of our providers. Those are pictures of either former or current, patients and clients. And even as recently as 2 months ago, we started revamping all of our, packets with information. Shout out to Steve, who's currently the cover face for our prep program. He's a gay man who's also our lead prevention specialist. Shout out to Sin. She's, on the cover of our STI info pamphlet, an amazing non-binary individual who works at our clinic. And then, of course, shout out to Anita, who is a beautiful trans woman who is also the face of our pamphlets concerning topics for trans individuals, such as binding and tucking. So yeah, I'd love to see the representation, not just in general, but a representation of actual members here in the community in a lot of the advertising that ARC does.
Wow, that's incredibly powerful because not only is your workspace and like the work that you do empowering your clients and the people that you work with, your colleagues, by not only representing the work that they do and the important work that they do, but also literally being the literal representation of, what a healthy lifestyle could look like and like what being proud of who you are being the main picture on a pamphlet. It's very important for us to be able to see ourselves in the spaces that we belong in. And that's why it's so important to advocate for each other and advocate for ourselves. And that leads me to our last topic of the day, which is digital advocacy and literacy, or rather digital literacy and advocacy. And so to be part of our digital spaces, to promote the work that you guys are doing in the individual spaces that you exist, whether that's your job at IBM or performing at a drag show that's going to benefit a huge portion of Living Positives fundraising, whatever it may be. I've seen you guys do this work, and I know that the communities that we're all a part of. Digital literacy is obviously critical when we're talking about these things. And so, especially for our youth, to build those future leaders so that they can advocate for our rights and for the spaces that we're part of. So, how can organizations continue to work together to close that digital divide and to ensure that the LGBTQIA youth are equipped to lead in their communities? And I'll just quickly add, Digital Lift is I feel so proud of the work that we do in every spaces that we go because we're helping individuals work on these devices and use them to facilitate their everyday lives, just like ordering a Cap Metro bus ride, using the app to track the app and seeing when it's going to pick them up, or getting online to sign up for an appointment to make sure that they have all their different vaccines and their tests and everything done at the right time. So opening that to you all and to how you guys can see the digital literacy doing the work in your own community. And we can start with Wayne.
Repeat the last part, please. I had it muted because my dogs are going crazy.
Oh, your army of dachshunds.
It's going like that for a leaf flew by
is
the window. What was it? Well, I'm sorry. One more time, please.
no worries. How is digital literacy important for advocacy within your own workspace or just your own community?
Well, I mean, for my workspace, especially for me, it's made me step out of my comfort zone and start doing things on my own rather than leaning on other people that are around me. Um, there's a guy on here, I won't say his name, but he's amazing when it comes to computer stuff, but I can't always depend on him. I need to start learning myself how to do it and then be able to pass that on to my consumers as well.
Yeah. And when we think of our youth and when it comes to digital literacy and being the advocate for themselves, the way that I also see it very tied to like the work that you do, Roman, is what I'm thinking of like getting the youth equipped with that knowledge of knowing like I am a queer teenager and I'm going to become part of the adult world. And that means workspace, housing, that means socializing, romantic relationships. It is important that we equipped our youth to know that these services, that these resources exist before it's too late, before they're deep into their 20s and they never knew that these spaces existed where they can be themselves, where they can be secure, find the spaces where they belong. What are ways that you've seen digital literacy impact your community in that way?
So it's always a big goal of ours here at ARC to make sure sexual health education and self-advocacy is a huge goal for everyone that works here. And we've seen, not even just like national data or statewide data, but data like here in our own agency show how improved the health outcomes for our clients can be when they have the right knowledge, when they have the right education, when they have access to these to the different technologies that we utilize every single day. That's why it's so important for us to be out, to be part of the community, to go to colleges and set up like health resource fairs where we can, give them access. If you have a phone, great. Here's some QR codes. We'll show you how to sign up, how to follow us on social media, see where we're going to be in the future. You don't have a cell phone, that's okay too. We've got paper, we're old school still sometimes when we have to be. We've got flyers that show, different testing availability, different resources and information about what we offer and what we can assist with. And we've seen when we're out there in the community, when we're at those resource fairs where young people, young queer individuals may be present, when we're at these college campuses and university campuses, letting them know that, hey, like we're here, we're allies in the community. And, if you have questions, come and see us. If something about your health is worrying you, come and see us. If you just want someone to talk to, come and see us. Like it really does really make a difference in the overall health outcomes for these individuals, especially for young people. When we get that education to them at a young age, especially those critical years, like leaving high school, going off to college, like that's really where we can see the biggest impact in their overall health going forward, possibly for the rest of their lives.
Um, I think or I know that every single topic that we address today, being healthcare, economic barriers, workforce, media and misinformation or misrepresentation, and then just digital literacy and advocacy. These are all different topics that are focusing on all parts of their lives, whether it's their mental health, workspace, their socializing, social circles, their romantic relationships. All of these different parts of everyone's individual lives are impacted through just getting access to that information. And with that being said, um, I would like to ask all of you guys if you have closing thoughts before we move on to our Q&A. Any of our panelists want to share anything that you guys would need to say before we go through that?
Just thank you. And if y'all use AI, just make sure that you're actually talking to it how you talk to your friends. Like I literally and excuse my language, I make that bitch work for me. I'm like, you're my assistant. You want to be Miss Assistant? You want to be Miss Zoe, Miss Gemini, whoever? All right, girl, get to it. So I have her write my Instagram captions for drag all the way to like, and also I will say like one of the last things that the last thing that I'll say to the question you asked actually, Alejandra, is I really, really, really like am super trying to to really like how we're saying like protect the dolls, protect the dolls. My skill set is like literally teaching people how to become like a little bit more polished professionally. So I'm like, fuck protecting the dolls. I'm like, let's get the dolls a job. Let's get a resume done. Let's put the resume inside of ChatGPT and have it, let's refine it, and like you can do that. You can put you can literally put any file into a chat model, y'all, and just say, hey, what are the key takeaways from this? You'll never have to read a PowerPoint again. Or you can ask it to make a PowerPoint for you. So there's just like a lot of ways that we can like actually like get off our own selves, how we have access to this computer. We're sat on this computer right now. Can you help somebody in your community that you know right now to do that? And which AI do I use? Okay, so I use AI for free through my work, but if you go in, but Google is also free. They're just getting a lot of data on you. But they're the most like they're the most like I would say like language savvy, and honestly will give you the better answers. So that's my answer to Wayne's question in the chat.
Thank you, everyone. And Ethan, go ahead and we can start the Q&A.
Awesome. So
Questions.
we did see a couple of questions in the chat. So let me scroll up here for a quick second. Bear with. Where'd they go? Where'd they go? Where'd they go? They moved. I saw Becca wrote them down. Becca, can you
Sure.
help me out for a second?
Of course. You guys have been so active with questions. We're going to try to get through as many as we can in the next like 9 minutes. To piggyback off of what Ale said when she was praising Digital Lift about a lot of the work that we do is technical. We provide devices, we provide device training, we provide skills training so that people are empowered and fully understand and are confident to do the things that they need to do in their life. And with that said, some of the questions that we got are fairly technical. So I'd like to also include Ale and Ethan in answering these. And let me say to everyone, we'll probably only get to a couple, but the ones that we don't get to, when we send out the follow-up email with all of the resources and the videos and things, we'll send out our answers as well. So to start with the technical question, Catherine Alexander says, I work at South San Francisco Public Library, and one barrier we notice is that some patients are given medical information on a CD-ROM, and they visit us and they try to view it, but it requires launching the software on the disk, and understandably, our IT doesn't want people running their own software on the PCs, and so it's blocked. And I don't know how to help with that.
Let's see.
If that's one we need to follow up on, we can, but I wanted to bring it up.
I think it is something we're gonna have to follow up on for sure. But my quick thought is ask the individual if they have an online portal. Because usually when a clinician or a practitioner gives you a CD, it has imaging on it. So it's my X-rays or my MRI scan showing where something is. But if they have a patient portal, it should work. Yes, Jessica.
Sorry, to pop in really quickly on that. If you know that that's a recurring issue with the same type of org that's providing things on CD-ROMs, you may consider reaching out to that organization and letting them know that this is providing a barrier, and that organization may in fact have another workaround for clients. So that may be an option there as well.
Awesome. Thank you.
Okay. I'll move on to the next one, but I will tell you, Catherine, we always regroup in the few days before we send out an email follow-up. So we'll try to offer more to everyone who's on this call. Let's try to get to a couple more. Michelle Vega said, in addition to the public library, is there already a public or private or nonprofit collaboration that has already or could create like internet cafe areas, free clinics, shelters, bus hubs?
Well, I'm working with an organization called Bastrop Cares. And so when they provide services to their communities, they're out in Bastrop. So a lot of the people they work with are even further away than the tiny town of Bastrop. They're in the neck of the woods. Well, they go to the parks and they bring mobile hotspots with their devices. And then they invite the clients to go to a public park with hotspots and devices for people to be able to use to sign up for the different resources that they have. And so being one of our partners through MHM, we provided them with devices with data-enabled hotspots and devices. And so they're able to use those devices to serve their clients to get the resources wherever they are, as long as they're able to get data on those devices, or rather signal. But different organizations do work like that, where they go to the clients with a hotspot and a device.
My knowledge, there are a couple of organizations that partner with local governments and other CBOs or community-based organizations to provide low-cost or no-cost internet service, either through public Wi-Fi at local parks or in some public spaces. It really just varies. Being from the Valley, the Rio Grande Valley in South Texas, one of the things there is one of the cities, the city of Mission, was looking into making public Wi-Fi free and accessible to all residents. Has it moved forward? I'm not 1,000% sure, but some cities have gone that far and made that initiative.
Roman?
I was just gonna piggyback off of what Alejandro was saying was part of some of the new initiatives that we're taking because our prevention staff here at ARC is trying to reach out to a broader spectrum because we cover Bexar County, but we also cover a lot of the outlying counties, Medina, Atascosa, Comal, and a lot of those, a lot of those are more rural areas. So one of the initiatives that was written into our grant for this coming fiscal year is the addition of a mobile hotspot for our mobile testing unit, as well as devices such as iPads, that whenever we go out to these, smaller, more rural communities where it's harder to gain access to things like Wi-Fi, we have everything set up because we made the change, at least in our prevention department, to go completely paperless. So everything that we do as far as paperwork and intake is all done digitally. So now we have, whenever we're set up in these outlying communities, we have a mobile hotspot where they can easily connect to Wi-Fi, internet, and we also have devices available for them for people who don't have any kind of like way to fill out our forms. So that way we've eliminated that barrier. So now all they have to do is come out and see us whenever we're there. And, I think going that way could help in a lot of ways, not even just here at ARC and some of our other departments, but for a lot of community resources that do similar work that we do.
I see one question in the chat, and I think Marco would be good to answer this one since the San Antonio AIDS Foundation is one of the oldest sexual health organizations in San Antonio and Bexar County. How can organizations like public libraries that already provide unrestricted access to the internet, digital trainings, electrical outlets, and social opportunities better support at-risk individuals and LGBTQIA plus folks?
Just to get a note, it's public libraries, right?
Yes.
Okay. So SAAF had partnered in a way with the libraries in the ways that we already talked to. Yeah, you're exactly right. The San Antonio Foundation have been 40 years serving the community here in San Antonio. So we had the experience of knowing how people move around the city in that way. That's why we partner with public libraries but not just public libraries. We had a great experience with libraries inside the colleges, taking a little bit advantage of that presence with youth that basically be there with them. Never be afraid to reach out to us in any way that you can think of. That's something that I really proud of my organization, that anyone that has the opportunity or has the idea that, hey, I would like to for your outreach staff to be at my library or at my event or whatever, they're there. Our outreach staff is amazing in that way, that they are ready to provide those services. And libraries are for sure key in extending the range of the information that is provided. Why? Because, for example, here in San Antonio, what we have seen is that people experiencing homelessness, for example, they're all ready to get access to the public library, to have access to their emails or to any other way that they can keep in contact with uh, their prescriptions or their appointments or all that. So being part of this organization is the work that we do is basically putting the information there and accessible. If we're not there, putting, again, like Romano was saying, old school flyers, infographics, all that to try to be there for them, that if they have the question, at least they know where to get the answers from. And that's something that the San Antonio Youth Foundation does really good at providing, just being there with the community. I think that would be my answer for that.
Thank you.
So I'm going to be the bad guy, which is part of my role, and bring this portion to a close so that we can get to some important announcements and giveaways. But I did want to say, Kate, Anna, saw your question about the two-step verification with the phones. We will reply to that. We know that that's important. We will get to that. And everybody rest assured, we'll scrub the chat one more time and send out some answers and resources in an email early next week, and we appreciate that. I want to, before I share my screen, I want to look at these lovely little faces and thank everyone on our panel once again. Happy Pride Month. Thanks for all that you're doing to help with digital inclusion everywhere, but particularly with your communities. I'm going to share my screen. I'm a visual person, and I think a lot of other folks are too. Ale, can you see the mark your calendar?
Yes.
Thank you. So everyone, just a few final announcements. You know the drill anyways. We started on advocacy concepts this month for a particular queer community and a crucial one. And what we'd like to do is continue with advocacy next month as well. July is Disability Pride Month, and we have a special webinar lined up with presentations from more folks that focus specifically on going beyond basic accessibility and self-advocacy. This is a QR code to the registration link, and we're going to have specific speakers from mental health, from other organizations that focus on accessibility first concepts. We're going to reach out to some of our MHM partners that have been very active, much like the ones in this presentation as well. And we're going to include Digital Lift staff. And what we want to do is go beyond the basics. We will talk about basic strategies, but we will also go beyond those for self-advocacy, for true accessibility, for celebrating disability pride, and for gaining more agency in all areas of life: workforce development, home improvements, maintaining vital connections, improving relationships, remaining connected, and just remaining in full control of life and appointments and healthcare. So we really look forward to that one. That's on July 31st. And we wanted to make a special announcement because we're running 25% off of our device training curriculum, but it has only been for a couple of days, and today is the last day. As you know, we offer field-tested device training curriculum in a variety of languages and on almost any device that you can think of with topics. We offer these full curriculum packages that basically keep you from having to reinvent or start any type of training program. Not only do they include extensive device training materials, but they're tailored for personalized pacing. They include fully downloadable, reproducible, customizable learner guides, training packets, multilingual content, culturally competent lessons, a variety of languages, as I mentioned, and these are fully updated for you if you order them. And just use the code. I have a QR code on the next slide, but to get this special 25% off today, it just goes through midnight tonight. The code is LIFT0625. I know I'm bombarding you with QR codes, but we have the links here as well. And you can always email us if you have any follow-up questions. But these curriculum packages allow you to transform not only your organization, but actually your staff and all the individuals that your staff work with. And once you get this curriculum, it's yours. It doesn't go away. It's fully yours. So we'd love to extend that discount to you all. And let's get on to the giveaway. No purchase necessary, dudes. So what we're giving away today is, in light of serving our community, we want to know our community. And for your programming, for your leadership, for your expansion of the work that you do, or for planning for the rest of 2025, Lord help us, and moving into 2026. What we want to give away is one of our program management courses called Assessing Community Needs. It's a variety of templates and resources and strategies for truly assessing the community that you want to serve and what their needs really are. It also involves how to collect the data that you really want and how to clean it and to analyze it in a way that works for you. You know, if you're like me, that's not a skill that comes naturally. So we've done all the work for you. And this is a $200 value. So before I do the giveaway, I do want to include this slide because it has our email. If you want to reach out to us about this webinar, about any other questions that you have before next week, please email us at lift@digitallift.org. And we're happy to hear any of your feedback, any of your questions or concerns. So I would prefer, just because I can't multitask, I would prefer for you to unmute and tell me if you're here. But we would like to give away Assessing Community Needs 2. Do we have Tyler Ratzlaff? You can chat me too, but I saw Tyler was on before. Okay. Do we have Nicole Stitch? I'm wanting to make a Lilo and Stitch comment here. Okay. Do we have Steve Silver? Do we have Asia Abang?
Yes, I'm here. Hello.
Asia, you got it. I will be following up with you with an email with your full enrollment in this. Congratulations.
Thank you. This is so exciting. I just started in my role and needed this. So when I heard you announce it, I was hoping and crossing all of my fingers and toes. So thank you so much.
Well, dude, Asia, when I email you, I'm going to email you links to a lot of our free resources and courses that we have that, like, you know, totally free. That could be helpful to you as well. I look forward to that.
Thank you so much. This is the highlight of my day. Everyone in the office will be jealous of me. I don't care. Thanks.
Oh my God, please brag and rub it in their faces. Do we have Evan Coates?
We do.
Dude, same for you. I'm going to follow up with you. It's a coming.
Thank you.
And do we have Kate Young? Okay. Maria Contreras?
Marie?
Or I'm sorry, Marie Contreras? Yeah, Marie.
In the chat.
There's here.
Oh, okay. You see what I mean? I really can't multitask. Okay, Marie, same. All right, that's it. 12:59, 1 minute early. Everybody enjoy the rest of your week. Keep up the great work, and we'll see you in July.